Thank you, Mr. Chair. First, I'd like to start with the nursing update. There were actually some questions about this from the members, so I'm going to start with wrapping that into what we're seeing here. So just a couple ways for you to view this and gloss it. So there's three categories in how our nurses serve our young people. One is visits by students. So that's simply when someone shows up unexpectedly at the nurse's office. And this can be for emergency or a drop-in visit, the bathroom, sanitary products. It could be a million types of drop-in things that are not planned. Med administration students is when a student is on a regular cycle of being given medical treatment or medicine by the nurse. And then there's screenings of students. If you look at the facing page, health service summary, there were a bunch of questions from many of you about what are the categories. So an injury event, I think, was self-explanatory. So someone got hurt, need a Band-Aid, sprained ankle, broken leg, that kind of thing. An illness event is like became feverish, had a bad stomach ache, had to go home, fever, all those types of things. I'll go to management next, which is case management, which is like calling all of the families who didn't have up-to-date vaccination materials with us. So those numbers are large right here because our nurses have been round the clock following up on those things. Physical forms, attending IEP meetings, 504 meetings, any call to a doctor that requires, they're trying to understand orders or they're consulting with the district physician, they put that under management. And then other health is like anything else that comes up that has no other category. So for example, if they're asked to document Medicare claims, that would be under other health activity, but it's none of the other things. So other health was a really large category, could be many, many different things. Okay, so those were the major questions. There was a request for some specific different breakdowns by building, which the nurse leader is working on. So I'll get that to those members when those are complete. But some other questions that came up are there certain buildings that have disproportionate number of illnesses or injuries of students and staff? And if so, is there a correlation to building age and conditions? This is something that we look at every single month. That's why I get these reports, and I thought it would be interesting for you to see them as well. There's no disproportionate numbers or correlation that we can see. However, in the wintertime, for example, if there is a physical condition that creates more ice or something like that, we see more slips and falls and those types of things. So for example, at Franklin School, before it was in construction, there was a consistent sort of water flow that flew through the campus and into the kindergarten basement. That area outside of the kindergarten area was always very icy. So there would be more sort of falls by the kids, more scuffed knees, those types of things. So, but we could correlate it one-to-one with a weather event. So we would work with buildings and grounds to chop it up or to redirect them to another place. So there are those types of moments where I have a meeting every Monday with buildings and grounds and our health services and all of our operational folks so that I can keep a handle on that. And we're looking for those types of patterns. There was a question, are there buildings that have disproportionate numbers of injury visits? There isn't really something that sticks out over time where we say the blank school has all kinds of, weird accidents or things like that. We don't have anything like that that has stuck out, at least in the time that I've been here. There was a question about, is there a correlation of health visits with student dysregulated behavior? And I will say that there are injuries that happen in certain programs where more social emotional learning or behavioral support is given, and that is true. And the older the students, the more often and larger the injuries can be. We do have protocols for that, and we also have after action reviews for each of those so that we're reviewing what happens in those situations, what was the antecedent to the behavior. And we're required by the state to actually put out reports on how we've handled that. And so we track any of those activities and it's collected by the state. And then the final question was, are there buildings with disproportionate numbers of staff illness visits that align with staff absentee data or serve as early warning signals? And I would add probably a question you might have is students as well. So this is something that Sue Riley, our nurse leader, and I talk about every week when we're starting to see the uptick. For example, you heard on the news that there was an elementary school in Massachusetts that closed this week due to a norovirus outbreak. That's the kind of thing that we're tracking, like how many cases of flu, when's this, I can predict some absenteeism based on what our nurse leader will tell us. And that's how we work with Health and Human Services, just to say, what are they seeing and what are our people seeing? Do we need to do any extra cleaning at any particular facility? Those kind of things. So that is part of what our weekly check-ins with facilities are. And as I said, there are some other reports that ask for breakdowns by school and other health events. So I'm happy to get those ready for that member, and I'll share it with the committee when they're ready. So that's nurses. I don't know if you want to stop there.
Any questions for Dr. Nolin on that piece?
Okay. So then I'll just turn to my regular report. Had a couple questions from members and new members about how do we determine when recess happens or doesn't happen. So here's the big secret sauce right here. There's a daily child care weather watch chart that pretty much the nation uses. And then we have a feels like 20 degrees standard that is used across the elementary schools. Now I'm saying that, and I just want to say, there might be a time where it's like 18 degrees and we go out, or 22 degrees and we don't. So I just want to say there's a lot of factors that go into it. That condition that I just said to you about the nursing report, like if the entire place is a sheet of ice, that might make a reason to have an indoor recess, even though the temperature itself might comply. So we really are looking to our principals to make that determination, but we also want kids to go outside. So recess is not held, we want to hold recess. So I just want parents to be reassured about that. It is very hard on those first couple cold recesses. A lot of the kids don't come with the right clothes. And so then you're in this situation of like 50% of the class not being able to go out and 50% going out. And it really just depends on coverage at that point. Do we have enough staff to have indoor recess and outdoor recess? And so there was one of those situations this past week that I heard more about than I've heard about recess in recent weeks. So just wanted you to know that's how we generally decide it, but it's not a perfect science. Second, we have a notice that our triennial wellness assessment is occurring with the Department of Education, and USDA requires that we participate in the child nutrition program and complete this assessment every 3 years. Newton will undergo this review, and we had it in 2023 as well. So we're right up front, chosen to go first. There are 4 areas that we will review: nutrition, environment, and services, nutrition education, physical education and physical activity, and employee wellness, which is assessed using the WellSat 3.0 tool, which is a research-based tool to assess how we're doing. Recommendations will be given, and it will be performed by our content educators and staff and shared with the wellness committee for the district to review and update any of our policies. So if there are updates and recommendations, it will come to you as the school committee to sign that in or not, and your policy committee will also vet it with the wellness committee. The wellness committee will start to meet on January 22nd. Alicia has volunteered to be a school committee representative here, but if there are community members who are interested in participating on the wellness committee, they should contact Tracy Sokolowski, our Director of Humanities and Wellness. So that'll be an interesting, I've sat on a couple of those for my former district. They're actually quite interesting and a good opportunity for us to make sure we have the best child nutrition and wellness programs possible. I want to recognize our Newton North students in the video courses there who took honorable mention and runner-up in the Mass DOT Safe Streets Smart Trips video contest. And if you just need a good chuckle and a good way to learn about driving safety, these videos are wonderful and they're really quick. And I say send them to every teenager you know. and actually some adults too. So enjoy those links and the videos, and congratulations to Newton North students for making such a strong showing. Another strong showing, we just wanted to officially congratulate Newton North High School for winning the Thanksgiving football game against Brookline in a very big venue at Fenway. Very proud of our football team and proud of both the teams. I know the Brookline superintendent quite well, and we both proclaimed what a joy it was. All of the students and parents and everyone just had a really harmonious time, even though it's an age-old rivalry. So kudos to everyone who organized the event. And lastly, keeping it short and sweet, boss,